What are the most common reasons which can cause knee pain, which common people experience and present to you?
So the reasons for which people visit me for knee pain are different.
How can someone identify whether the knee pain is something which is a temporary knee pain that will need a specialist attention? How do we identify?
Where knee pain can happen without injury or old age. These usually fall into the conditions of.
Now let's talk about posture, lifestyle, because that is something which is a very commonly asked question.
Most of the time when we think of posture or we think of office and ergonomics, we tend to focus on the back and the neck. And yes, of course, most of the cases which happen in the neck and back pain very commonly happens in those who have a desk job or those who are sitting at one place for long periods of time.
Is a weight gain is a factor which is contributing to knee pain in any way, like obese people or someone who is overweight?
Yes. So those who are classified higher chance of having pain in the joints of the lower limb over their lifetime.
So is there any role of stem cell therapy? Yes or no, Dr. Ravi?
Usually start in old age, but the main basis for that is your diet during your growing age.
Namaste everyone, welcome to yet another episode of podcast with me, Dr. Amitabh Kulkarni. This is a place where we identify simple topic, common topic. We try to understand it in simple language from the experts in the field. Today's topic is yet another common topic which can affect our ability to move forward, knee pain. Almost everyone has experienced knee pain at some or the other points in their life. Sometimes we blame it to wear and tear. What exactly is wear and tear? What exactly is age-related knee pain? Today I am very happy. I am joined by Dr. Ravi. He is an experienced and trained orthopedic surgeon who has seen numerous cases of knee pain or knee-related problems. Today we will try to understand from him what exactly is knee pain, what are the reasons for knee pain, what you should not be ignoring about knee pain, and how to deal with it in a professional and authentic way. Welcome, Dr. Ravi. Thank you for accepting the invitation and coming for our podcast. Dr. Ravi, can you tell us something about your background?
Thank you, Dr. Amitabh, for having me today on this podcast. It is wonderful that you have started this initiative.
Thank you.
Hi, everyone. I am Dr. Ravi Nayak. I am a specialist orthopedic surgeon. I'm currently practicing in Dubai since the last 8 years, but my experience extends to almost 2 decades. My specialty is in knee, hip, and shoulder surgeries, especially joint replacement, arthroscopies, and sports medicine. I have published numerous papers on these topics. I have been trained at centers of excellence in India, the United States, and Germany, and it's great to be on this podcast today.
Thank you, Dr. Ravi. So, Dr. Ravi, let's start with the topic. What are the most common reasons which can cause knee pain, which common people experience and present to you? What are the common reasons?
So, the reasons for which people visit me for knee pain are different based on their age. Younger people usually visit me for knee pain after injuries or after vigorous exercise, whereas older people visit me for knee pain which is more to do with their old age rather than any injury.
Thank you, Dr. Ravi. So, is it always related to age then? The common misconception is that when you become old, you get knee pain. So, is it always related to that?
No, that's not true. There are other conditions as well where knee pain can happen without injury or old age. These usually fall into the conditions of rheumatoid arthritis or uric acid, which happens especially in Dubai in this weather, where people don't drink a lot of water,
right.
And then you can have these conditions which cause knee pain.
So, are there any surprising reasons for knee pain you have ever seen?
So, what happens is that we see a lot of patients who just walk into the clinic saying that I have knee pain, and then it happens that it doesn't turn out the way that we expected it to be.
Right.
For example, I had this young child who was growing up, we thought it was growing knee pain,
Okay.
and then it turned out that she had chondromalacia, which is very uncommon at this age.
Correct.
Probably it was because of the sports that she engaged in. So it can surprise you.
So that takes us to the next question. As a common man or as a common person, how can someone identify whether the knee pain is something which is a temporary knee pain, probably related to exertion, or is it something more than that that will need a specialist attention? How do we identify that?
So usually for someone to have a pain which follows an injury, it is very easy to identify the reason. So there was an injury and then you have the pain, you can attribute it to the pain. But sometimes it happens just without any reason, and in most cases it should go away within about 3 weeks or so.
Okay.
So if the pain persists beyond 3 weeks, then I would suggest that you should seek medical attention.
Okay. So in those 3 weeks, then what should they do for the knee pain?
So I wouldn't say come to the doctor as soon as you have it. So you can try to restrict your activities. Try not to do a lot of floor activities because the knee gets inflamed, especially with floor activities, whenever you bend the knee more than 90 degrees. So you have to avoid those activities like climbing stairs, or don't sit on a low sofa, low chair. You need to sit on something high, 18-20 inches from the ground, and you need to avoid uneven surfaces like sand or stones. If you do that, I think most of the times the pain will go away.
Yeah.
Even without medicines.
So that was a very, very valuable information. Friends, please understand, if it is going on for more than 2 to 3 weeks with the usual gels or pain medicine, it's better to seek an opinion from the expert related to that. Now, Dr. Ravi, quite frequent is seen that people get pain after exercise. Like they do exercise probably for the purpose of staying fit. But then they start getting knee pain after the exercise. Is it related to pain, or is it something which is in the exercise which they have not been doing it correctly? What is your take on that?
This is a very interesting question, and this is something that I see on a regular basis. Now, exercise should be done according to your age and according to the activity levels which you have been maintaining since before. For example, if you have never run a marathon before 35 years of age and someday you decide at 50 years, okay, I will start running a marathon, that is a sure shot way of getting some damage to the cartilage in the knee. So how do we decide what is the activity level that we should allow for ourselves? One rough marker that I would suggest is that if you are doing some activities into your mid-30s, like around 35 years of age, then you should probably continue those activities even after 35 years of age. For example, if you have been running regularly or you have been playing tennis regularly before 35 years of age, then of course go ahead and continue with the same active lifestyle. But if you have never run a marathon before and before 35 years of age, the most that you were doing was sitting at a desktop and tapping on your keyboard, then I would strongly not recommend to go for very severe activities initially. You should train yourself. You should devote a large amount of time to see whether your body can cope up with the stress. And any sign that you feel that probably this is not the right exercise for me, then I would suggest you need to look out for some other sport or some other activity which will not cause long-term damage.
So you don't recommend any sort of vigorous exercise all of a sudden if your body is not used to it for a long time, something like that?
Definitely.
Yeah.
So I do see a lot of ladies, especially those who have not been exercising since a long time, and they decide that okay, we have to lose a lot of weight, and they have a trainer with them, and they usually end up doing a lot of weights. Like, who needs to do 120 kilos of leg press? Are we going for the Olympics?
So you have to be very careful when you are starting exercise probably late in the life, and my suggestion is always to seek an expert opinion if you are going for like extensive exercise or vigorous exercise schedule. Now, thank you, Dr. Ravi, for clarifying this. Now, let's talk about posture, lifestyle, because that is something which is a very commonly asked question. Which posture is good? And nowadays our lifestyle is such that we are just working eating and sleeping. That's the only thing we are doing. The only other thing is traveling from one place to another place for work. So how does this matter for our knees? Like our lifestyle, sitting in one position for a long time. Most of us are doing a desk job. So does that affect knee also? What is your say about it?
Yes, so what happens is most of the time when we think of posture or we think of office ergonomics, we tend to focus on the back and the neck. And yes, of course, most of the cases which happen in neck and back pain very commonly happens in those who have a desk job or those who are sitting at one place for long periods of time. For example, when you're driving a car.
Right.
So, but the knee is also affected. How does that happen? So if your car you're sitting very close to the steering wheel, and you're continuously shifting your leg from the brake and the accelerator, that affects the knee.
Okay.
So I do see patients who are driving long distances, maybe 1.5 hours continuously, and then they come to us with knee pain. And in those cases, it becomes very imperative to see what is the distance of the seat from the steering wheel. It also becomes important to take breaks in between. You shouldn't be driving for long periods of time. We give a rough time of around 40 minutes to around 50 minutes, after which they could probably stop driving, step out of the car, take a round around the car. And this reduces the incidence of not just knee pain, but back and neck pain as well.
So this is a very, very interesting observation which you have said, that even correct posture even when you are driving is very, very important and important for our knees and spines. Now coming to the weight loss, now is a weight gain is a factor which is contributing to knee pain in any way, like obese people or someone who is overweight. Does that cause knee pain?
Yes. So those who are classified as obese, so obesity stands for something where the BMI, the body mass index, is more than 28. Those patients have a higher chance of having pain in the joints of the lower limb over their lifetime.
That is even when they are walking normally, you mean to say?
Yes, even when they are walking normally.
Okay.
So what we would recommend is that you should try to keep your weight lesser. However, there are studies which is I'll tell you a very interesting fact. If you are not in the normal BMI, which is still 25, and if you are slightly overweight, which is between 25 to 28, you're neither obese, neither are you in the normal weight range, that is actually beneficial when you are in your growing age and when you are in your early adulthood. So somewhere between 15 to 25, that is in fact good for the bones, because the bones become stronger when there is weight on them. And having a little bit of overweight, not obesity, mind you, a little bit of overweight is in fact suggested to have better effects on the body, on the bone mass. But if you go into obesity and progressively if weight and BMI goes up, so we see patients with BMIs like 40, then that is a recipe for disaster for the knees. And if you do have some pain in the knees, it progresses at a much faster rate with higher BMI than if you were in the normal range.
So listener, please understand, obesity is not just a risk factor for diabetes, hypertension, heart disease, kidney disease, brain disease. It is also not very healthy sign for your knee joints. It can cause knee problems in future. Now then, how much weight loss do you recommend in those people who are obese?
So once you have, even without knee pain, I usually recommend that you should not lose more than 10% of your body weight in a particular month.
Is there a time frame for
in a particular month? So if you're 70 kilos, you don't want to lose more than 7 kilos in a particular month. That would, maybe you lose it quickly, but then there's a very good chance that it can come back. And that is what we see in most of these patients who go for this quick fix centers,
crash course to lose weight. Correct.
Very true, very true. And then it tends to come back. Instead of feeling healthier, you tend to feel tired, and then you may end up getting a significant amount of that weight back.
Thank you very much, Ravi, for this simple explanation. So now, if someone has a knee pain which is unbearable and they seek your opinion as an expert, is surgery the only option? What are the non-surgical treatment options for this?
Widespread misconception that knee pain means that the doctor is going to suggest surgery. That is not true. So there are many modalities before we go in for surgery. Well, most of the cases are very well controlled just with activity modification, with some minor medicines to control inflammation, and probably some physiotherapy. In more advanced cases, we may give injections. We suggest injections for lubrication and to reduce inflammation. And if those don't work out, then probably surgery is the last option.
So surgery is not always the first option. You always try without surgery in those patients who have a severe knee.
That's very correct.
Or
yes.
related issues. Now, in today's era, there is a lot of discussion about supplements, home remedies, and we do see a lot of information by so-called experts on social media about some supplement which will reverse your arthritis or osteoarthritis, knee pain, don't go for surgery and all. So what is your take on these supplements which are easily available as online? If you go to say any e-commerce website and if you want to buy a particular supplement which your friend is taking, you can immediately buy it. Do you really recommend those supplements or any home remedies for knee pain? If yes, which one do you recommend? And if you know, why do you not recommend?
So there's this big discussion about supplements. There are pros and cons of each, and there are very many kinds of supplements available. In medicine, we say that if there's a condition which is not treatable, then the treatment options for that will be many. The large number of supplements itself suggests that it is not a perfect solution for the given condition. And there are supplements like glucosamine, there are chondroitin sulfate, and there is MSM, there are curcumin. So there are a large number of supplements. There were very good emerging studies which suggested that these were good for the initial stages of arthritis or probably sports injuries. But very few studies have supported them from other centers. So it is very difficult to just support it or say, okay, it doesn't work. Probably some cases where these may work, these supplements may work, as I said, is in cases of early arthritis, early degenerative arthritis, if you do visit a physician in that stage, or in cases of sports injuries where some supplements have found promising results. But to tell you the truth, we doctors follow evidence-based medicine, and if there is no evidence to that effect, which is from many different centers, it becomes very difficult to suggest that as an option.
So more the supplements, more is the confusion for everyone. So it is always wise to take the expert's opinion in this situation before experimenting those supplements which are quoted from the unverified places. So sometimes you also give some injection within the knee for such pains. Does it come under any of these treatment options?
No. So the injections, so if the knee pain is not getting better, maybe with medicines or with physiotherapy, then the next option would be to do something like an MRI, which shows us, is there any significant cartilage damage, or is there any meniscus injury, or is there any pathology inside the knee joint which is not getting corrected from outside? Because most of the treatment that we're doing, the gel that we're applying, is on the outside. The medicine that we take is just a temporary phenomenon. So if that inflammation is not settling down, then we need to do something locally, and locally means inside the knee joint. So what are the options? We have anti-inflammatory injections which will reduce inflammation. These usually I suggest for those probably who want to take a trip of Europe, and they have for 4 to 6 weeks, they want to be free of any kind of pain because you have to do a lot of walking, and you unfortunately tend to get knee pain before that, which is not getting better. So that is one of the reasons. Then some patients want to go on Umrah or Hajj where they have knee pain. Again, they want to be pain free for that duration of time, and we suggest it not as a quick fix, but just to tide over that period of high levels of activity. The other injection is a lubrication injection. So that works in early to moderate cases of arthritis, or in early cases or some types of cartilage or meniscus injuries. But those are highly selective cases and have to be decided very well before we decide to go in for the injection.
Thank you, Dr. Ravi. So then, when do you decide about surgery then? And like, what are the cases where you say that now, yes, now the medical management is done, and you need to go ahead with surgery?
So the concept of surgery is that the knees are like the wheels of the body. Just like you have wheels in a car, the knees are the modality which help you to go about, maintain an active lifestyle. So if your ability to maintain an active lifestyle, for example, going to work or playing the sport that you want, gets affected by your knee pain, then we suggest knee surgery as a means to remove the knee pain and get you back to the things that you like to do.
Thank you, Dr. Ravi. So, is there any progress in the types of surgeries which you have seen over a period? Like, is there any particular type of surgery is being done, or what is it exactly?
So, since I've been on orthopedics now almost since 2 decades now, it'll be 2 decades next year. So, since that time, I have seen a lot of new advances in knee surgeries. Earlier we used to have bigger incisions. Now the focus is towards minimally invasive surgeries which have faster recovery, there is lesser pain, and you can get back to an active lifestyle. But yes, it's not for everybody. But then we do tend to give suggestion based on the age of the patient, what kind of activity he wishes to perform in future, and based on that the surgery is suggested.
So, in addition to surgery or the medical management, frequently we as a physician also hear about stem cell therapy. So, is there any role of stem cell therapy? Yes or no, Dr. Roy? So, I'm sure you must be encountering these questions. Yeah.
Yes. This is something that we come across daily.
So many times we have to tell yes or no. Don't
Yeah.
experiment, or okay, worth trying. So, what is your take for stem cell therapy in knee pain?
So I would say for stem cell therapy, the same thing that most insurance companies would say. It is experimental, so they don't approve it. All said and done, stem cell therapy seems to be very promising. However, at current stages, it is still in the primitive research phase, and the idea of the stem cells actually working. What is a stem cell? Stem cell is a totipotent cell. A totipotent cell means it is like a kid. Is a 12th standard kid who can become an engineer, who can become a doctor, who can become a lawyer. You can become anything. But we have still not been able to find out the stimulus which makes that cell into a bone or a cartilage, or can even turn into a hair or a tooth. So you don't want any teeth in your legs, right? So it's not. I'm just joking. It doesn't happen. But yeah. So then the stage, it's still primitive. So I usually don't recommend this treatment for my patients.
So it's probably too early to comment about stem cell treatment for knee pain, and if it is too early and we are not sure as a physician, probably better to avoid this treatment and go with the evidence-based confirmed treatment.
Correct.
Thank you, Dr. Ravi. Now, over a period of 2 decades, I'm sure you must have heard so many concepts or misconceptions or myths about knee pain. So what are the myths you must have been hearing about the knee pain, which are myths, and people need to know and understand that.
There are a lot of misconceptions. Yeah. So one of the most common misconceptions that I see is that patients feel that if they have knee pain, they have to push themselves further, and that will reduce their knee pain.
Okay.
Now, this is like saying that if you have a wound on the hand, you should rub it more so that it heals further, which is absolutely wrong. You should give it rest, just like any other part of the body. You should give it rest. And that will help in the healing process. So this is something that I see very commonly.
Thank you for clearing the myth, Dr. Ravi. Now, with a growing age, what will be your advice for someone who is getting old? How do they protect their knee as they age? Like, are there any tips or exercises which you recommend in these people who are growing old and they want to protect their knees so that they should not encounter any arthritis or any severe knee related problems in future?
Correct. So, what we recommend for people who are aging is that you need to maintain an active lifestyle. It doesn't mean that if you're getting older, you should not, you should take more rest. You should try to maintain an active lifestyle according to your abilities. You can engage in stabilization exercises, balancing exercises, because as we grow older, there is an increased risk of falls, especially in those who are above 65 years of age. So we ask them to engage in balance exercises like Tai Chi or yoga, which help to improve balance and reduce chance of falls, which can otherwise give rise to injuries and fractures.
So stay active as you grow older, as Dr. Ravi said, so that your knees will be maintained healthy. However, understand that over exercising or vigorous exercising may not be as healthy as you may be thinking about. Okay, so now coming to the last question of the discussion, what advice would you like to give to our common public, from the younger population up to the old population? And old population about the knee through this discussion?
So, one common thing which I normally see is we feel that all of these joint pains, the knee, hip, shoulders, usually start in old age. But the main basis for that is your diet during your growing age. So, the peak bone mass that we reach is actually around 25 years of age. What does that mean? That if you have a healthy diet consisting of calcium and a vitamin D, which is good for the bones,
right,
and a good protein intake, that will help to build a bone mass during your teens and your early adulthood, which will help you sustain an active lifestyle later in life. All throughout your life, it will be useful. And with all the dieting fads that we see in the younger generation nowadays, I would strongly recommend that don't wait for to get old to experience all the joint pains. You have to concentrate on a diet. You need to have an active lifestyle. Engage in sports. And for those who are older, yes, as I said, you need to maintain an active lifestyle. Do what you like. And if you feel that you're restricted in your activities, we're always there to help you get back to an active lifestyle.
So healthy lifestyle, healthy diet and active lifestyle.
That is true.
Everyone should be maintaining this. Thank you, Dr. Ravi, for the answer. Now this brings to the end of today's podcast. Today we have learned that knee pain, the root cause for knee pain may start quite early in the younger age or teenage, before it manifests sometimes later in the life. Thank you, Dr. Ravi, for a clear and detailed explanation related to the causes of knee pain, how to deal with it, what we should not be ignoring, and then some of the myths which you have explained. Now, friends, please understand the purpose of this podcast is to clarify the doubts from the experts, which is evidence-based medicine. If you have any doubts related to today's discussion about knee pain, you can mention in the comments. We will be very happy to answer those doubts or questions. If you want any topic from Dr. Ravi in future, please mention it in the comments. Please like and subscribe to the channel. Please forward this to someone who is dealing with this knee pain, or someone whose relative or old parents or someone friend is dealing with this type of knee pain. Please understand that knee pain need not mean surgery always. So don't get scared about showing it to the expert. It's not that the surgery is the only option for this treatment. As Dr. Ravi clearly mentioned, it starts with your lifestyle, your diet. We still give some pain medicines or something conservatively before opting for surgery. Surgery is always going to be the last option in the treatment. So please don't ignore your knees. Take the help from the experts in time so that you can move forward. Thank you very much.
Thank you, Dr. Amitabh. It was great to be here on this podcast today. Thank you very much.
Thank you very much.